Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain oculopharyngeal muscular dystrophy, which is one of the CPEO diseases, or chronic progressive external ophthalmoplegia. The link between ophthalmology and the GI tract is important. Different diets can alter the composition of the gut microbiome, and these bacteria can produce proteins that act as inflammatory markers. This can trigger systemic inflammation that affects the eyes, especially if the eyes also contain proteins that resemble these markers. Oculopharyngeal muscular dystrophy is a form of CPEO with dysphagia, which is a problem along the GI tract. The oculopharyngeal muscular dystrophy is a form of chronic progressive external ophthalmoplegia with dysphagia. This usually onsets and presents itself to the patient after 40 years. And the trademark sign of this disease is the slowly progressive bilateral and external ophthalmoplegia that affects all directions of gaze. Let's look at the anatomy of the retina before we move on. When you view the retina through a fundus exam, you may find different parts of the retina. The fovea and the macula is located in the temporal side, and this has the highest concentration of cones that make up your central vision. Optic disc is located nasally, and this is a point of exit for all the ganglion cell axons. The light converting here will not be perceived, and thus this forms a blind spot. The vessels of the retina and both the veins and the arteries can be seen also with the fundoscopy exam. The cross-section of the retina will reveal that the retina itself has lots of different layers. That includes various different nerves for communicating, ganglion cells for receiving the eventual electrical signals that has been translated from the light signals, and photoreceptors for the translation of the signals themselves are present. The Bruch's membrane is the deepest layer, the outermost layer of the cornea, I should say, and it borders the choroid, which is a supply layer of the posterior uvea that feeds the retina. Some risk factors that will make an individual have a higher chance of having this disease includes age over 40 years and certain populations like French Canadians and Bukharan Central Asian Jewish population of Israel. Because it involves the mutation of chromosome 14 arm Q, family history of anyone with this disease will make it more likely that an individual may have the disease as well. Some symptoms of oculopharyngeal muscular dystrophy include CPEO, dysphagia, decreased vision, ptosis or droopy eyelids, tearing up, and a feeling of foreign body inside the eye. When seeing a patient with this disease, you may notice signs such as CPEO. Sometimes visual acuity may be decreased. And on extraocular movement, the eye movements will be very limited. Ptosis, orbicularis oculi weakness, as well as superficial punctate keratitis may be seen, and on fundus exam, RPE changes may also be observed. The differential diagnosis for this disease includes the upgaze and downgaze palsies, progressive supranuclear palsies with patients presenting with Parkinsonism, dorsal midbrain syndrome, and myasthenia gravis. So do a complete and thorough ophthalmic history from the patient and conduct a neurologic exam paying attention to the cranial nerves. Measure the visual acuity and look into the extraocular movements, which also tests for cranial nerves 3, 4, and 6. Pay attention to the lids and pupils, as well as cornea. Possible investigations for this disease include the mitochondrial DNA analysis and muscle biopsy to rule out MERRF, another form of CPEO. Consider anti-acetylcholine receptor antibody and IcePack tests to rule out myasthenia gravis. If CNS processes or neurologic infections are suspected, do a lumbar puncture to rule it out. And swallowing studies can be done if the esophagus is doing its job to down the food. Treatment for this disease includes topical lubrication every hour, plus an ointment in the eye before bed. This is to prevent exposure keratopathy. For ptosis that diminishes function by getting in the way of vision, we may consider surgery. Unfortunately, the prognosis of oculopharyngeal muscular dystrophy is poor, like other diseases in CPEO, and this prognosis is related to vision. So hopefully we were able to show you that the oculopharyngeal muscular dystrophy demonstrates a link between ophthalmology and GI specialties. And here is a summary chart of everything we have talked about with regards to this type of CPEO. And here is the reference. So thank you for watching this video.